Thanks, Glenn. Thank you guys for inviting me back. I was here back in 2004, and I intentionally actually didn't change my presentation because in the past 7 years, some things have changed, but most things haven't changed. So I will be taking a little bit of editorial license with this presentation. I'm going to go over the parts I think are boring. I'm going to add a few parts which I think are funny, and I'm going to try to keep you guys entertained and informed. So I hope it goes well. I don't know, but you saw that crazy wind today? I don't know if you've ever had one of those. So I came to work on my bike, and I had to go home, take a shower, and come back. I don't know if you've ever had one of those nightmares where you're running and you can't move because so the wind was blowing, and I said, I'm going to be late. All these people are going to be waiting for me, but I made it on time, so I'm glad I'm here. All right. So, private parts is what we're going to talk about tonight. We're not only just going to talk about what women's anatomy is. That would be just too boring. This presentation has been censored. Glenn's had a look at it. It's something he's proud that I present in front of his mother. I hope he got you a generous gift for tomorrow and some flowers. So, and some of you may have pacemakers. I'm not saying anything about anybody in the front row or second row, but so we got to make sure we keep it calm. And my in-laws may show up, but they're not in the audience, so I got to make sure I'm not embarrassed. So we're going to talk a little bit about female anatomy so that you understand exactly how women are made up physically. Here's how I'm going to divide the talk tonight. Talk a little bit about getting pregnant. Not so much about naturally. I'm guessing at your stage in life, most of you understand how people get pregnant, the old-fashioned way. What I'm going to show you is the new-fashioned way because more and more couples need help to get pregnant. They're not having babies like you did when you were in your 20s. They're having babies in their 40s. It's changed the ballgame. So we'll talk about artificial pregnancy. I'm going to talk a little about preventing pregnancy because it's a crazy world. There's some people desperate to have babies who can't. Other people who just get pregnant too easily. So we'll talk about what's available now to prevent getting pregnancy. And I'm going to show you how pregnancy has become complicated. I feel sorry for today's young people. I'm a young person. I got little kids not that long ago that I had my kids. The decisions that a pregnant woman has to make now in terms of screening and all these tests has, I think, transformed what was a natural great event into a make-work project. I'm sort of critical of it, but I'll present to you what today's young people, what decisions they have to make in terms of keeping a healthy baby. Talk a little bit about the Pap test, because everybody's heard about the Pap test. Explain to you what it is and what it means, and then we'll talk about women's problems, which of course could be hours and hours, but I have to cram it all in. So, these are the parts. Life starts in here. This is the uterus, the female uterus or the womb. This is where babies are incubated for 9 months. Basically, women have ovaries. That's the equivalent of the male testicles. Ovaries produce eggs. Eggs are fertilized by sperm in the fallopian tubes, and pregnancy occurs in the uterus. If you look at an actual picture of what this looks like inside, people are quite amazed the first time they actually see the reproductive organs of a woman who's not pregnant. It's amazing that a little uterus the size of a small pear at the end of 9 months can accommodate a human or two, or in some cases 3. So it is a really remarkable thing. And I guess one of the themes about women is the cyclicity of their menstrual periods and the cyclicity of life. How a woman can create a life, deliver the life, go back to normal and do that over and over and over and over. Some Lubavitchers will do it 15 or 16 times. Most of us have 2 babies, but some people do it more than others. So, what's the most important sex organ, folks? The brain, right, because it all starts from the brain. So even though the ovaries contain the eggs, it's actually a signal from the brain that tells the eggs to mature and develop every month. That signal continues to be sent throughout a woman's life. So if the brain works and the pituitary works, how come a woman of 50 or 60 can't get pregnant? Somebody tell me. Eggs get old, so eggs no longer work after a certain age. If you really look, maybe I got a little slide on that. I'll get to it in a second. So, as I said before, for a woman during her reproductive period, her life is based around the cycle of her menses. It's an amazing event. For a healthy woman, and women who know their menstrual cycles know them very well, will know that in about 28 days from a previous period, they can expect another period. And most women know very well, they know their bodies, they know when they're ovulating. In the middle of the month, the body releases an egg, and they ovulate. And then if that egg is not fertilized 14 days later, the lining of the uterus is shed. That's called a menstruation or a period. If a woman is pregnant, that obviously doesn't happen. If she's breastfeeding, it's not happen. What's interesting about modern society is that today's modern woman menstruates much more than women used to. If we go back a century ago, so we're not going back 1,000 years ago or 1,000,000 years ago in evolution, a century ago, a woman would become pregnant pretty soon after the onset of her period. She'd get pregnant. During her pregnancy, she wouldn't release an egg. During breastfeeding, she wouldn't release an egg or have a period. And then sooner or later, she got pregnant again. If you look at how women's bodies behaved a century ago compared to today, it's quite different. So women had few menstrual periods. And by the time they went into menopause, most of them died. Average lifespan was late 40s, early 50s. Today's woman, unless she's taking a birth control pill, which prevents this process, can be expected to have many periods. She's not going to, many don't breastfeed. Certainly the average number of pregnancies in Quebec is about 2. So we believe a lot of the diseases that we see now as epidemics, breast cancer, ovarian cancer, endometriosis, all of these can be linked to more frequent menstrual periods. So Mother Nature probably didn't intend women to have a lot of menstrual periods from the time they're 11, and certainly the career woman who doesn't get pregnant starts menstruating at 11 and may menstruate, and the term is incessantly, nonstop, till she goes into menopause. So having babies and breastfeeding seems to be very protective against certain diseases. It's protective against breast cancer. It's protective against ovarian cancer. So some of that may be related to this. I'm going to take a break from my little presentation for a second, and I'm going to show you what I think is a pretty funny clip related to the hormone changes of a woman's menstrual cycle. Volume.
But we noticed some subtle things we couldn't share.
Subtle things that happen every 28 days or so.
It's nobody's fault.
Well, just nature doing its job.
But it didn't seem right that I was excluded.
Well, thanks to the wonderful people at Merck Frost, we can both now share the PMS experience.
Monthly man. It allows me the privilege of the female experience.
Each capsule contains tiny time-released hormones that surge through your system, taking you on the emotional roller coaster ride of your life.
It's beautiful. I never realized how wonderful.
Don't worry, I'm here now.
What's that supposed to mean?
So we'll get some ice cream and talk about it.
Well, look floated to you.
So, just getting back to our to the show. The change in hormones throughout a woman's menstrual cycle can explain some physical and in some cases emotional problems. It's a very controversial area because women's groups and feminists are very sensitive to the idea of medicalizing a normal cycle. So pharmaceutical companies have promoted certain drugs like antidepressants and certain birth control pills to treat PMS and PMDD. You have to understand that these conditions actually exist in the diagnostic medical manual, and they've been classified as diseases. So premenstrual syndrome and premenstrual dysphoric disorder, which is severe PMS, like you're going to kill your husband or kill yourself, is actually recognized as a medical and psychiatric condition that can be treated. And there's quite a bit of controversy as to whether, is this really normal or are we medicalizing something? In any case, certainly hormones do have an effect on women physically in terms of fluid retention, bloating, swelling, and there is no question that there are certain women who certainly have anxiety, depression, irritability that comes on before their menstrual period, which is relieved with their period. So PMS really does exist. So I told you I'm going to sort of go over a few things which I think are less interesting and talk to you a little bit about early pregnancy. I want to talk to you now about how people are getting pregnant these days. Just to step back from the presentation. The average age of first birth in Quebec today, anybody want to give me a number? It's the average age of a woman's having her first kid. 35 is old. No, you're wrong. It's about 29 and a half, 30, which is old. Which is old. Most of you, I'm not making assumptions, generally had your first baby somewhere in your early to mid-20s. And that's a huge quantum change, really, in a generation. Fertility clinics are filled with patients. The majority are there for having delayed pregnancy too late. And the truth is, we don't do so well for older women. There are a whole host of reasons why women have trouble getting pregnant. Let's look at them for a moment. Just in terms of ultrasound, we are able today, with ultrasounds done vaginally, to identify an early viable pregnancy about 4 or 5 weeks from a woman's last period. Maybe 6 or 7 weeks till we see the little baby in there, but that's very, very early. Today's early pregnancy test can tell a woman she's pregnant even before she's missed her period. So technology is getting very, very good. And by the time a woman is about 9 weeks from her last period, so she's been pregnant 7 weeks, we see this easily recognizable image of a human being. This is probably 2 or 3 centimeters in size. So modern technology certainly allows us to identify a baby in a woman's tummy way earlier than you guys would have known you're pregnant. But I'll make the point, it's a double-edged sword. We now are able to give women information early in pregnancy that I will argue they didn't need to know in the first place. And we are medicalizing what should be a beautiful natural process and creating it as sort of a medical condition. I'll explain what I mean in a few slides. We can even tell when a pregnancy is no good very early, because by the time the baby looks this big, it's not even a baby, it's an embryo. We're talking something about 1.5 centimeters. We expect to see a heart beating. If the heart's not beating, we can tell the woman this is not a good pregnancy. So, pregnancies can occur in the wrong places. They can occur in the fallopian tube. This is an example of an ectopic pregnancy. So here is a view of inside a woman's body, and we see that the pregnancy is here in the fallopian tube, and she's already bleeding internally. This remains, believe it or not, the #1 cause of mortality in pregnancy in North America. Women used to die in childbirth of hemorrhage, of infection, of seizures. In fact, the #1 and 2 reason now are ectopic pregnancy. They hemorrhage internally. In Canada, it's not an issue. Women have access to medical care. In the States, it's actually more of an issue. The other major issue women die now in childbirth is related to having blood clots and high blood pressure. And I'll get to that in a little bit. So let's look at infertility. The next little, let's say 10 minutes I'm going to talk about is what these fertility treatments are all about that you're hearing about. Again, just to take a step back from my presentation, in August of this year, the Quebec government made a momentous decision. Anybody know what that was? Yeah, to fund fertility care. Now, that itself is a debate we could have for an hour. Many doctors actually weren't in favor of this for a variety of reasons. Though it sounds like a wonderful thing, you all know we have a limited health budget, and I would argue that in a medical system where patients are waiting weeks and months for cancer care and routine care, I'm not sure this should have been a priority. It was, at the end of the day, a very political decision because of a couple influential women who had friends in the government and said, let's do this, it's a wonderful thing to do. There are a lot of wonderful things we could do, and I'm not sure it's our obligation as a society to fund this. If you got to do it, you got to do it, and if you have to pay, you have to pay. We can't cover everything. So it's a subject maybe for discussion. But 15% of couples are infertile. It's not a he or a she problem, it's a couple problem. It is as likely to be a female problem as it is to be a male problem. Think back on all the biblical women who've been described as barren and infertile, and how many cases it may have been a male issue. So it's on the rise, and it's on the rise mainly related to the fact that women are waiting longer to have their babies. And remember, the first point I made is that old eggs are not as good as young eggs. They don't fertilize as well, they're less receptive, and there are more and more abnormal pregnancies in women as they age. So it's male and female. It can also be combined. When we look at what goes wrong in women so that they can't get pregnant, here are the main causes. Very simple. Those tubes that I showed you get blocked, and they're normally blocked because a woman has had an infection of her fallopian tubes which she never knew about, and diseases like chlamydia and gonorrhea damage the tubes. Women don't release an egg every month. They have a hormone problem, and they don't ovulate. This condition called endometriosis, which I mentioned before, is actually a very prevalent gynecological problem. It's a condition where the lining of the womb grows in places it shouldn't, like the ovaries, the bladder, the intestines. It's a condition that causes severe pain and infertility. It's a horrible condition. It's a chronic condition. It can be treated with hormones or surgery, but it's a tough one. Age as a major issue. And this is the one that's very difficult. I feel terrible when patients have this. It's called unexplained infertility. We don't know. So these poor women undergo a battery of tests. They get poked and prodded and ultrasound, and their partners are normal. There's no explanation. It's a very frustrating condition. Yeah. I thought somebody had a question. I wanted to show you what happens to fertility and miscarriage with age. It's a very simple slide to look at. This is a maternal age down here. And this describes fertility. And look what happens. In the late 30s and early 40s, it plummets. It drops dramatically. And miscarriage rate increases dramatically. So by the time a woman is about 43 or 44 years old, spontaneous pregnancy is almost unheard of. I know everybody here in the audience, but I know a lady, she got pregnant at 51. Everybody's got a story. I'm still waiting for a 50-year-old who's pregnant spontaneously to roll into our labor and delivery floor when I'm on duty tonight. Been on duty for 20 years. We do 5,000 deliveries a year here. I'm still waiting for the 50-year-old who got pregnant spontaneously. When you read in the newspaper that a 51-year-old's having a baby, she bought an egg from somebody else. It ain't hers, okay? 9 out of 10 times. Can't buy eggs so easily. So there's a lot of fancy schmancy techniques to get folks pregnant. Basically, it's called IVF, in vitro fertilization. That's what you hear about all the time. Patient had IVF, and the even more high-tech something is called ICSI. So let's take a moment and show you what those are all about. Let's show you what those are all about. We'll show you a little high-tech stuff. Yeah, first of all, to do this in vitro thing, they got to give a woman a lot of drugs to make her ovaries make a lot of eggs. It's really simple. They inject the woman with injections that make her eggs go into overdrive. And I'll show you what a picture of an ovary on overdrive looks like in a moment. So, just conceptually, woman gets an injection to stimulate a lot of eggs. The doctors go in with an ultrasound probe in the vagina, really long needle, and they try to suck out as many eggs as they can. They put the eggs in a test tube in a petri dish. They put Loverboy sperm in the dish. They incubate it for 3 or 4 days. Some underpaid technician looks under the microscope and says, I see an embryo, and they put the embryo back in the lady. That's in vitro fertilization. So, first of all, how do we get the eggs? Well, let's see. It's got a little bit of this sci-fi music, I think, too. That's what an egg looks like on hormones. It can swell to the size of a grapefruit or even bigger. In fact, a woman can die from this condition. It's called ovarian hyperstimulation. It's a very serious condition, and it's one of the serious health risks of in vitro. So what you're seeing here, folks, is a little needle. This is an ultrasound. And what he's doing with that needle, pop. And look, as he sucks out the egg, that little follicle, it collapses. So this procedure is done under fairly heavy sedation. It's not horribly painful, but it's uncomfortable. And if you look, the doctor continues with the needle. This is the skilled part of this procedure. He's busy, basically, that's the word we use as specialists, sucking eggs. It's a great job. It's like being a dentist. 9 to 5, you go home, nobody wakes you up at 3 in the morning. Everybody wants to be a fertility specialist now. Turns out the government covering it's a good deal for them. They're making a better living now than they did before because it was expensive. It was about $8,000 a cycle to get pregnant. And the doctors had all sorts of deals. You take 3 cycles, I'll throw in a Subaru. I mean, they were, working all sorts of deals. 3 for 1 if it fails. There was a guy at the Vic, he was a real entrepreneur. He's no longer there. No names for tonight. I'm going to be a gentleman. Anyways, turns out doctors get nervous when Medicare covers something. They always end up doing better when Medicare covers it. So that's it. That's egg retrieval. I promised you that there's something even a step beyond this. So, to repeat, if a woman is, not having a kid because she's got a hormone problem or tubes are blocked, you give her a lot of drugs, make a lot of eggs, suck out the eggs, put them in a dish, incubate them with the sperm, put them back in the lady. You guys all understand that? Pretty simple, right? So there's big tsuris, anybody who needs a translation in this audience, if the male sperm don't work, right? Doing in vitro fertilization, you got to have sperm that swim. Even though you're bypassing the normal way of doing things and putting them in a dish, they still got to be good swimmers. If they don't swim very well, I'm trying to be sort of folksy with my presentation. I know how to speak English, but I'm trying to bring it down to the common person. If they don't swim well, or he doesn't have many sperm, in the past, a man couldn't biologically be a father. We'd say, listen, you got to adopt, you have no chance. Today, even men with very few sperm or very slow-swimming sperm, they don't look so good. The sperm look a little schwach, if anybody needs a translation. They can't swim, they're not going so good. Maybe it's an older guy with a lot of gelt. He wants to have a baby by a 29-year-old. You know, you don't know anybody like this, but you know what I'm talking about. So this is called ICSI. And ICSI, I'm going to show you what ICSI looks like. ICSI means taking an individual sperm, which is so small, you can't even see with a microscope. High drama. Here's the little sperm right there. Look. So you take a needle with this single sperm and you poke it into the egg under a microscope. Look at the drama here. Look at that little sperm. The anticipation is killing that sperm. I can do it. I know I can do it. I know I can do it. You can't do it. You can't swim for crap, but we're going to help you. Look. Maybe the father was a smoker. Maybe he smoked too much marijuana in the 60s. Who knows? We're coming to the stunning climax. That's it. Fertilization occurs. Beautiful. This is how I used to have to sell in vitro. $8,000 a crack. You had to put on a good show. I don't do this stuff anyway. I'm busy saving lives upstairs. I'm doing mitzvahs. But these guys are running a nice little clinic. Anyway, that's called ICSI. Stands for intracytoplasmic sperm injection. Now, sounds good, right? And there are babies. There have been thousands of babies conceived this way. Problem is, if it's too good to be true, it's not so good. Studies show very clearly that there's a much higher risk of malformations in babies born this way. So, you know, it can be a sort of a mixed blessing. You have a kid, but the kid ends up with physical problems or other intellectual issues. So don't mess with Mother Nature. If you bypass, you know, normal fertilization is the following. There's one willing egg and 100 million sperm. So only the best looking, strongest sperm wins. You end up with somebody like me. Look. This shirt's from Ralph's just last week, right? But if you bypass the normal way things are done, you end up with a sperm which should have never fertilized the egg in the first place. So you got to be careful with this stuff. Okay, back to the presentation. Where was I? All right, so we talked about how they do it, and this was really just explained to you, but you guys understood the idea. Take the egg out of the mom, fertilize it in a dish, and then put the little embryo back in through the woman's vagina into her uterus, and she has a baby. This technique is responsible for hundreds of thousands of humans on this planet. It's a great achievement. It was developed by a couple British gynecologists. They won a Nobel Prize for it in 1978. In fact, the first woman, remember her name? Who's the first girl? Who's Louise Brown? Herself had a baby, and she had a healthy, normal kid. So it's a remarkable thing. It really is truly amazing. And I mentioned complications. Complications are what we're going to see upstairs tonight. Multiple pregnancy. In the good old days, when patients paid for this and they were desperate, we'd put back 3 or 4 embryos. It's the single most common reason that multiple births increase. And I'm telling you, for a healthcare system, multiple births, twins, triplets, it's a very risky pregnancy, premature birth, huge cost to all of us. Now that patients can't call the shots and the government pays for it, government was smart. You can only put back in 1 egg. So it's better for everybody. IVF works very well. Pregnancy rates are like 35-40%. It's as good as natural conception. I didn't mention that among a healthy couple, the odds of getting pregnant per month are about 25%. So, you know, after 3 months, it's 50%, 6 months, about 75%, and after a year, it's about 85%. If a couple hasn't gotten pregnant in a year, chance of getting pregnant are very, very low on their own. So now let's change gears a little bit and look at preventing pregnancy. You guys all know about abstinence. I'm not saying personally you're abstinent. You may have very healthy sex lives for people your age, but abstinence is accepted as a form of birth control in all cultures. It's fascinating. I'm very interested in cultural attitudes towards birth control. If you really look at, it's interesting to digress, cultural attitudes towards contraception. So Jews, understandably, have many, 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 many opinions and are actually fairly liberal in what's accepted. Orthodox Jewish women will accept many methods of birth control happily. Islam also, surprisingly, has a fairly broad spectrum of opinion. It's not black and white. It's Catholicism, which is very rigid about birth control and still continues to believe, I'm not saying it's personal belief of any Catholic person here, don't be offended, but the Pope and his entourage are very anti-oral contraception and condom. So if you look at religious and cultural attitudes towards contraception, they're all different. The pill has been around forever. We'll talk about the other methods in a moment. I'm going to show you a funny clip. I love this one. I think this one's cute. The good old condom. Well, good old condom is okay. Low tech, no drug side effects. Problem is it's very, very ineffective. People don't use condoms properly, can't trust guys to put on condoms, maybe religiously unacceptable to certain patients. So, or the safe, as I think they called it in your day. What do they call it? The safe. I can tell a patient if she still calls it the safe. So, let's talk about what's going on in Canada. Canadians know nothing about birth control. Canadian women are surprisingly ignorant. So women know about the pill, and actually Canadian women actually are comfortable and safe with the birth control pill. About 63% of them think it's a great idea. Turns out about 40% of Canadian women are very enthusiastic about male vasectomy. Big surprise there. Less enthusiastic about the condom, and they're less enthusiastic about things that they don't know much about. IUDs, sterilization, tubal ligations, all sorts of stuff. What can I say about the birth control pill? Birth control pill, first of all, it works really by preventing the egg from being released every month. It is very safe. It is very effective. Let's talk about the safety. You can't turn on the news, pick up a paper without reading about the risks of birth control pills. Now, I prescribe a lot. Sometimes drug companies take me out for dinner because I talk to doctors. So I'm going to be honest. I have to give you an informed consent. I am paid to sometimes talk about birth control. All right? So I'm going to be honest with you. I'm not a chazer. I get paid to talk about birth control. The birth control pill has done more good than harm on balance. There's no question in my mind. If you look at the benefit of birth control pill in terms of preventing unwanted pregnancy by itself, you can't argue anything but good. An unwanted pregnancy is a horrible thing no matter how it goes. Now, I always tell patients who are tormented with the idea of having an abortion or not. I've been in practice for 20 years. I used to do abortions till I was stabbed by a psychotic boyfriend of somebody who did an abortion. So I stopped doing abortions not because I believe it's a horrible crime against humanity, because I simply didn't want to die myself. I have 4 kids, and I said, I'm not prepared to do something that's going to get me killed. I have never to date met a woman who regretted having a kid. I see patients who's had a baby and it wasn't really the right time. And I say, how's the kid? I love the kid's gorgeous. He's smart. I have met, and here I'm going to, I like to get a little controversial. I have met hundreds of women who regretted having an abortion. And even though I defend the fact that we live in a country where it is safe, it's legal, and it's available. And I don't think we should ever take that away. So I want you to hear where I'm coming from. The liberal group has convinced women it's sort of a no big deal. It's like having a teeth cleaning. Abortion's legal. Let's just get it done. And I believe that's wrong. I believe that there is, for most women who do it, a permanent psychological scar. They remember it. They never forget it. So making birth control available and preventing abortion is a good thing. And certainly preventing pregnancy where the baby is neglected or the child's neglected or treated badly is a good thing too. So the birth control pill has done humanity a huge service in preventing pregnancies and reducing abortion rates and rates of unwanted pregnancies. In 1995, when there was the same controversy there is today about birth control pills causing blood clots, the pill is named Yaz or Yasmin. It's all over the newspaper based on crappy research that even doctors can't understand clearly. In 1995, when there was a scare related to the risk of birth control pills, which was later shown to be wrong, pill was safe, there were measurable increase of abortion rates across Western Europe. So preventing pregnancy is good. It is very clear that the risk of cancer with the birth control pill is nil. It does not exist. It is a fiction. In fact, there's clear scientific evidence of the best quality that the birth control pill reduces the risk of ovarian cancer, which you all know is a lethal, horrible disease, by 50%. It reduces the risk of uterine cancer by 50%. There's absolutely no link between birth control pills and breast cancer. The latest study, which was published in the British Medical Journal, I didn't put up a bunch of studies today because it's going to lose you guys. All the statistics will spin your head. So I'll summarize it for you, and I'm not making it up. British Medical Journal, it's one of those peer-reviewed journals. It means it's a good, reputable journal. It's a study of the Royal College General Practitioner study. These are British family doctors who've been following women for 40 years on birth control pills, show that women who ever took birth control pills had a lower risk of death overall, period. It seemed to extend their lives by preventing cancer. So there's really no argument to tell a woman don't use the pill on the basis of safety. The issue of causing a blood clot is also overblown. The risk of a woman dying of a blood clot if she gets pregnant is 12 times higher than that of her getting a blood clot on the birth control pill. So it's really a non-argument, and I will go down on record as saying for the appropriate patient, and that is a young, healthy, slim, non-smoking woman under 40, the pill does more good than bad. And I want to say that very, very strongly. So these are the myths. It causes cancer, it causes blood clots, blah, blah, blah. And the truth is, actually not. Prevents cancers, less risky, has no real effect on weight. The IUD, which was something that was very in the 70s and then disappeared because doctors got sued over complications related to IUDs, has completely been revamped and changed. This, in fact, is probably the most appropriate, effective, safe method of birth control for women, let's say 35 and over. It's as effective as having your tubes tied. There's a new IUD which has hormones that are only released locally. It's very, very good. There are new things like a patch. So a woman can wear a patch on her skin with hormones instead of swallowing the pills. This one sounded really good, but it turned out it had a higher risk of blood clots because it delivered more hormones into a woman's bloodstream. So patch is available. Women can even put a little ring in their vagina. It's not a diaphragm. It's a hormone-releasing ring. It contains the same hormones the birth control pill does. But the trick is here, instead of swallowing the pills, the hormones, they're absorbed directly into the bloodstream by the vagina. The result is less goes to the liver, lower dose of hormones in the woman's body. She doesn't have to remember to take a pill every day because she only puts the ring in once a month, and it's a real winner. I know it's good because my Orthodox Jewish patients like it. So if they think it's good because they generally know what's good. This delivers low dose of hormones. It's associated with very good control of the menstrual cycle. They don't bleed when they shouldn't bleed. And really that's the number one reason women go off hormonal birth control, because they're bleeding all the time. Now, we're going to stop for a second, take a break. It's time for some funny stuff. So let's go back to, I talked a little bit about how women get pregnant these days, what we have to prevent pregnancy. I think I should talk for a few minutes on what it's like to have a baby now in 2011, because it kind of hasn't changed. They do really come out the same way, but it's changed. So let's look at a few funny things. Well, let's look at this one.
We're actually okay if you want to clock out.
Well, Maria, I'm Dr. Gordon, the anesthesiologist.
Do you charge by the hour, or how does that work? Keep on breathing, sweetie. Keep on breathing. I don't want to pay all that money for this closet. Is this something that I can do? Yeah. Do you need that, Clara? I've got some ibuprofen right here. Hello, Tony. Hello, Maria. Almost fine. You're about 5 centimeters down. Just throwing money away. Just throwing it away. Any questions? I've actually got one. Hold on. Do you guys know they're cooking?
And let me see, I got another one funny. Let's see where my other, oh, this is adorable. This is adorable. I thought that one's adorable. All right, one more just to explain what's going on with the multiple birth situation. Everybody remember Nadia Suleiman? Do you remember her? All right, let's enjoy this one.
The story of Nadia Suleiman, the mother of 8 simultaneous babies, becomes more late every day. It's been reported that she's shopping a video of herself giving birth to the octuplets with an asking price of $1 million. Now, we did not purchase that video. We don't have $1 million, but we did actually get a clip of it. And if you've never seen 8 babies born at once before, well, take a look.
Very good, Mr. Lamont. Just breathe. You can breathe. Now push. Push!
So, I have actually nothing prepared on this, so I'm going to, this is very easy for me to talk about because this is what I'm going to go upstairs in about an hour and a half while you're all cozy at home in your beds. This is what I'm going to be facing all night long. So, childbirth. First things first, the cesarean section rate in North America, most of the developed world, in 2011 is 30%. So, almost 1 out of 3 babies today are born by cesarean section. And it's a good thing and it's a bad thing. First of all, women today do not go through some of the horrid childbirths that some of you may have or may have heard about. So, childbirth is a pain-free, essentially safe procedure. Women don't die having babies anymore. That's not a small point. Throughout the developing world, maternal mortality remains a huge issue. There are something like 365,000 women a year who die in childbirth. The risk of death in childbirth in North America is so low, I can give you a number, it's maybe 1 per 10,000, and that's probably stretching it. It's 40 per 1,000 in Afghanistan. So we've done a lot with childbirth in terms of antibiotics, anesthesia, and making it a safe experience. So I get irritated when people, nudniks who are armchair quarterbacks who say, well, your cesarean section rate is too high. Any obstetrician who's delivered a baby will trade a C-section for a horrible 4-step delivery where we mangle a woman's vagina and rectum so they don't look like anything human anymore. She ends up with a hysterectomy, a blood transfusion, and a kid who doesn't end up going to Harvard. So we've done a lot of good with the way we practice obstetrics. Pain relief is a non-issue. Everyone can have an epidural. It's available 24 hours a day. However, it's a double-edged sword. Having an epidural too early in labor is probably responsible a little bit for a high C-section rate. Is she okay? I hope so. Okay. Does somebody want to maybe look after Mrs. Klein? Is she okay? I think she's okay. She's looking at me, so she's got to be okay. I lost my train of thought. So about 30% of babies are born by C-section, a lot of epidurals, and I told you multiple pregnancy is a big issue. It makes for very complicated deliveries. Most of those babies are born by cesarean section. And I guess that's really all I wanted to say about actual childbirth. We've done a lot to make it a safe experience. Mothers don't die and babies don't die. We'll take a second, make sure she's okay. I think she's okay. Color looks good. Maybe not so good. Is there a real doctor here? Show must go on. Okay. All right, folks, the show must go on, so the show's going to go on. She's okay. So let's take a moment and talk about, I told you that pregnancy has become very medicalized in terms, in terms of prenatal diagnosis. So we'll talk about some of the decisions women have to face now in terms of having a baby. First things first. Okay, I'm going to let her walk by, make sure you're okay. So everybody wants to have a perfect kid. The truth is humans are born with birth defects. In fact, minor or major, about 1% to 2% of all babies are born with some abnormality at birth. Could be something major and life-threatening, like an abnormal heart or missing a brain. Those are incompatible with life. Or it could be an extra finger, something trivial. Some of these are physical, right? You understand that if a baby's born with an abnormal heart, it's otherwise a genetically normal person whose heart is malformed or has an extra finger. But some human beings have a genetic problem. That's much more profound. That's when all the genetic material that makes you up is wrong, and there are many abnormalities. An example would be Down syndrome, right? Trisomy 21. Everybody knows what somebody with Down syndrome looks like. So that's a genetic problem, and that's generally a much more pervasive problem. So we need to know about those because many couples will decide to abort, terminate a pregnancy where the baby has something genetically wrong. As a doctor, it's important not to be judgmental. Let the patient make their decision. Some women will decide they will keep a baby with Down syndrome. They understand this means caring for somebody like this who may be institutionalized for the rest of their life, but they believe life is sacred and they would never terminate a pregnancy. It's a terrible term even, terminate a pregnancy. It means something significant. So, not all of these are detectable. First things first, we're not perfect, we miss things. Ultrasound has really revolutionized the diagnosis here. So here is where an excellent technology has been used and maybe abused because we are now disclosing information about pregnancies that nobody needed to know. The mother didn't need to know, I didn't need to know, the in-laws didn't need to know, and putting women in positions where they're making decisions about things that sometimes we don't even know. We don't know what the natural history is. We find a little shadow. We consult the internet. We say, well, this shadow could be one of 28 things. Some are terrible. Some are not so terrible. What do you want to do? How are the patient supposed to know? She didn't need to know about this because some of these shadows just go away. It turns out to be nothing. Before you know it, they're on the phone with a cousin in Chicago, of course, is an expert in ultrasound, and he's suggesting all sorts of funny tests. So it's made life difficult. The one thing where we have gotten pretty good, and again, it depends on your perspective. I do say this with a certain humility because not everybody considers somebody with Down syndrome a life that shouldn't have lived. You know, my kid is doing this friendship circle thing. He's been amazingly affected to see that people with Down syndrome have certain measurably intelligence. They can be affectionate. They're capable of doing things. So putting women in a position now where they terminate a pregnancy that maybe would have not gone to term by itself, who knows? It's really quite an ethical question. Let's look specifically at Down syndrome because this is something every obstetrician presents to his pregnant patient. Of course, having a baby with Down syndrome increases with age. The majority, actually, surprising to everybody, are born as a complete surprise to women under 35. So even though age increases your risk, a woman of any age can have a baby with Down syndrome, and often it can be a complete surprise. Certainly remember 2 patients in my practice, young women in their 20s, who were devastated. We would have never thought to even suggest that they test for it. The amnio procedure, you've all heard about an amnio procedure, what that is? Amniocentesis means putting a needle in the woman's womb, withdrawing some amniotic fluid, and doing a genetic analysis. Till about 10 years ago, that was all we had to offer. So until 10 years ago, young women were either surprised by this, and women over 35, considered to be at risk because of advanced maternal age, were offered a test where we put a needle in, withdrew some fluid, and saw what the story was. And they could be told your baby's normal or not. That test was associated with a risk of miscarriage, somewhere around 1 in 400. So they looked for a better test, and this is the better test. This is a test which is offered today to all pregnant women, regardless of age. It's a non-invasive test. There's no risk to the mother. It's an ultrasound. This is a profile of a baby's face at 12 weeks, 3 months of pregnancy. We're talking something that's, the baby's about 5 centimeters, about that size. But by high-resolution ultrasound, that's a beautiful human profile, right? Forehead, nose, that's called the nasal bone, upper lip, chin, neck, chest. This little fold of skin in the baby's neck is called a nuchal translucency. So as early as 12 weeks of pregnancy, we can see by ultrasound a fold behind the baby's neck. Measuring that fold tells us the risk of Down syndrome. If it's a thick measurement, it's no good. Could be Down syndrome, could also be 100 other things ranging from cardiac problems to kidney problems. This is an abnormal one. You see the big fold of fluid behind the baby's neck, and the nasal bone is less clear. We also don't see a very clear chin. So, this ultrasound, combined with a blood test, can detect about 93% of Down syndrome without a needle test. Now, if it's a woman over 38, I think we're doing a good thing. You want to know if your kid is okay, you could do this test. Problem is, we offer it indiscriminately because we're nervous doctors and we don't want to get sued because we didn't offer a test. So the test is offered to pregnant women regardless of age. And I would argue to offer this to a 24-year-old, where her risk of having a baby with Down syndrome is 1 in 1,500, and offering her a test which actually has about a 1 in 100 chance of giving her a false alarm is a terrible thing to do to a 21-year-old girl who would have otherwise had a happy pregnancy, not worried about it. And today's women are increasingly, they want to know more. It's an information-driven society, but it's also a society of neurotics who I think have to know too much. There's one thing to empower people with information. There's another to make them crazy about all the things that they might have. And I think it's terrible. I think we've taken a beautiful event and made it medicalized. So when it comes to Down syndrome, I think the jury is still out about that. Now, as a society or as a government, we're arguing about what test are we going to offer, because the sad truth is that patients have to pay $300 or $400 to do this test. Government doesn't do it. We don't offer it. So patients have to do it in private clinics, so they got to pay, and it adds a whole area of complexity. I've spoken for about 55 minutes, which I think is probably enough for any speaker. Maybe I'll look for the next 5 minutes, go through some of the other gynecological problems. I'll leave you editorial license, but I'm going to talk for another 5 minutes. I won't bore you to death. I want to make sure I don't have another fun video I forgot to show you, because those are great. It wasn't that. It was removal of this. Let's see if I didn't show you anything. Monthly man, baby's coming. No, I think I hit the highlights. That was enough for funny videos. You know, the women suffer from a whole bunch of other problems. Painful periods, heavy periods, fibroids, cancer, all sorts of stuff. And men, of course, being a major, major problem for women. Women grow all sorts of amazing things in their body. These are fibroids. You've heard of fibroids? These are benign tumors of the uterus. They can grow enormous. They're very, very common. Don't read the information. Listen to what I have to say. These are very common. They're a common source of, in the old days, hysterectomy. What I'm trying to tell you, I guess, in a nutshell in the last few minutes, is these days, women are lucky. We have a lot of non-surgical alternatives to some of the terrible problems that they suffer from, ranging from medication to little surgeries done through the belly button without a cut. That's called laparoscopy. Again, to use my editorial license, even with that, we've gone too far. We have, I believe, doctors using technology for good, but also irresponsibly, doing complicated procedures with a little camera and putting in 7 holes instead of a little cut, and spending 8 hours to do something that can be done in an hour and send the patient home a day later to say, look what I did, I have a fancy toy. And so the flip side is surgeries take a long time, we do fewer surgeries, and patients wait longer for surgery. I'm not so sure it's a wise thing. These minimally invasive surgeries clearly have a higher risk of serious complications. So a lot of them go well, but when they go bad, they go very bad. Sometimes we got to use seichel. So sometimes a little cut and a 1-hour surgery is the way to do it. That's my little editorial comment. So obviously for a woman with a huge tumor like this, you can't do it with a little cut. You got to make a big cut. So that's a fibroid. That's a huge fibroid. I was just showing you. A much younger me. That woman went on to have 2 kids. I put her uterus back together, and she went on to have 2 babies. So I'm not going to talk about any of the fancy surgeries. Finish with the pap test. Everybody knows about a pap test. Women still don't get what a pap test is about. What's a pap test? First of all, you've heard about it because it is the single most important, successful screening test in the history of medicine. So I know you're all running for mammograms and cholesterols and colonoscopies. If you look at a disease where we did good, and you know I meant to say where we did well, but I'm making it a folksy presentation, it's cervix cancer. This remains worldwide. I told you women die in childbirth worldwide. They don't die here. Well, guess what? In China, India, Sub-Saharan Africa, Central Asia, women still die of cervix cancer. It is the #1 cause of cancer death among young women. It's a tragic death because it's preventable. It hits women in their 40s, in their prime, when they have a young family. and it's preventable. It's preventable with a screening test that takes a couple seconds and can be done by anybody, really. It's not a complicated test. So, number 1 cause of death worldwide, number 12 in Canada. It's way down the totem pole, nowhere near. There are about 1,600 cases a year in Canada and only 400 deaths. They're terrible deaths. I'm not poo-pooing it. But if you compare it to breast cancer and colon cancer, no comparison. Pap test prevents this horrible cervix tumor, which actually takes years to develop and has no symptoms until it's very, very, very late. And 99.9% of these cancers are preventable. There are very rare cervix cancers that occur even in women who've had regular pap tests, but those are extremely rare. So it's one of those good things. The test actually tests for the effects of a virus. So to conclude, cervix cancer is a sexually transmitted virus. In fact, the doctor who discovered the link between this virus, it's called human papilloma virus, and cervix cancer, won a Nobel about 5 years ago. It's a doctor named Zurhausen. This is almost the first condition in medicine where it's very clear a malignancy is related to a virus. And the tricky thing about this is that 85% of us will pick up these viruses with sexual activity. The only women who don't get cervix cancer are nuns, because they don't have sex. The rest of us, well, maybe middle-aged Jewish guys in Côte St. Luc, don't have a lot of sex, excluding myself. I bought the shirt. I was hoping to. Anyway, we'll see. I also bought a suit for this talk. I didn't wear the suit. Let's go with the shirt. I don't like a suit. We all get the virus. This is the funny thing, right? Because we end up seeing patients referred, 70-year-old widow from Westmount comes see me with HPV. She says, "Doctor, how did I get HPV? My husband's been dead for 10 years. I haven't known another man." That's how they talk in Westmount. She hasn't known another man. Okay, I haven't been active. Well, because we all pick up this virus in our early teens and 20s. If you don't have muzzle and you pick up the wrong virus and it lingers for years and you don't know about it, it can cause pre-cancer and then cancer. So it turns out, concluding remarks, that we can now test for the virus. The Pap test, which has been this hugely successful test for 40 years, was good, but now we have even better. Because a Pap test is not perfect. It misses things. It tests to see whether the cells look funny. Thanks to the groundbreaking work of one of our doctors here, somebody I have a lot of admiration and respect for, his name's Dr. Alex Ferenzi. He's really known worldwide. Like, my reputation extends to the other side of Côte d'Ivoire. This guy, they know about him everywhere. I'm hoping one day, maybe I got to wear a suit, I don't know. I'm just not smart enough, I don't know. Maybe my humor doesn't cut it in sub-Saharan Africa. His doesn't either, but he's a genius. And he has introduced to the Jewish General Hospital, effective March, the test for HPV, which has been actually commercially available for years, but he convinced, with his foresight, force of character and knowledge, he convinced our government that it's a wise thing to do. It makes sense. The test is much more sensitive. It's much more accurate. Here's the good news. If it's normal, you only have to do it every 3 to 5 years because it's such a good test. So, I don't want to leave you the message, you shouldn't go see your doctor. Yes, you see your doctor. But women of a certain age don't need to do Pap tests anymore on a regular basis. Women of a certain age don't need to go regularly. What age? The clear recommendations of every cancer society is, first things first, not to start till a woman's 21. If she's had 3 normal Pap tests in a row, now with this HPV test, she can wait 2 to 3 years to do it. If a woman's 65, she can stop doing it. Now, I'm not saying 65, you don't have to see the doctor. I know you want to come once every couple of years to Jewish, you want to do your hair, put on some makeup, wait in the waiting room, show me you're alive, right? All right, I'll examine you. Concluding message, if you have a symptom, go with your gut feeling, right? If you have pain or bleeding, go see your doctor. If you're feeling perfectly well, you're golfing in Elmridge a day a week, you're going to shul, you feel good, you don't have to come see me religiously for Pap test at 71. You want to come, you can come. You don't have to come so religiously. So, that's what a cervix looks like. That's how we do a test. Blah, blah, blah. I think, really, I have said enough. There's final words. Oh, okay. Yeah, somebody mentioned, don't tell my mother what I do for a living. She still doesn't know. If she knew I did this vaginal rejuvenation, I'd be dead. More importantly, don't ask me questions about hormone replacement next time we meet at the Cavendish Mall. I hate when they come to me in the pharmacy. And that's it. Oh, my God, I got more presents. Thank you very much. It was a pleasure talking to you all.
Thank you very much, Dr. Ziegler. The flowers are not from me, and I've never seen this in 9 years of mini-med, but two of your former patients brought flowers or sent the flowers here to your presentation.
Beautiful.
So that is definitely a first.
That's a very touching, generous gift. I'm not going to embarrass the woman. She's in the audience tonight. I am touched by this. Thank you very much. I'm almost speechless. Thank you. And I'm rarely speechless. Thank you very much. She knows who she is.
Now we'll get to the questions in just a moment. I will give you a full disclaimer. My wife happens to be on call upstairs also tonight, and now I know why she picks the nights that you're on, because you can charge a minimum and a cover, and doctors will pay to come see you as well.
I hope.
So if there's no deliveries tonight, she'll be entertained for sure. So right to the questions.
You know, I have to say something. The truth is, Glenn's wife and I are sort of partners. There is a problem. It's not even the first question. I always get, how come nobody can find a doctor? Turns out there are not enough of us in Quebec. It's very hard to find an OBGYN because it's hard to find some sucker who wants to be up all night, have a risk of getting sued, lose his sleep, and, you know, I'm 31 years old. Look at me. No, I'm kidding. So sleep deprivation. You can't pick up a newspaper without reading how bad sleep deprivation is for your health. So Dr. Judy Hagshi, his wife, who's a family physician who does obstetrics, and I have worked out a system where many of we share pregnant patients. She has more time and expertise in outpatient care. I cannot possibly fit the demand. So patients see her, they love her, they get time, they don't feel rushed, come back to me about a month before their due date, and I follow them till their due date, where they feel rushed and harassed. But anyway, they get to deliver here and they're very happy. So we're partners, as it turns out.
And on to the questions. Yep. Very lengthy questions. I'll try and read them clearly. If a woman has never been on the pill, do they have a higher risk of ovarian or uterine cancers?
It depends so everybody heard the question? If it's a woman who's had multiple pregnancies and comes from a low-risk family, no. Women who are at risk of ovarian cancer are women who've never been pregnant, and also women who carry a gene for ovarian cancer. You've all heard about the gene, right? BRCA1, 2, which is restricted mostly to Ashkenazic Jewish women and women from Quebec, from the Lac Saint-Jean-Saguenay area. Remember that genetic ovarian cancer only explains about 10% of ovarian cancer. For 90% of women with this disease, it's bad karma. You're not born with a gene, you don't know about it, you just end up with it.
Okay. Regarding termination of a pregnancy in Tay-Sachs, is amniocentesis still the test for this when the couple are both carriers?
Yeah, it does remain the test for it. The best case, obviously, for Tay-Sachs. Tay-Sachs is a metabolic disease which is exclusive, essentially, to Orthodox Jews, and generally only populations of Hasidic Jewish communities where they're very, very intermarried, but not necessarily. The best scenario is to be tested to see whether you have this gene before pregnancy. In fact, among Orthodox Jewish communities, they do sort of a confidential testing for a variety of these inborn errors. And when a couple is considering a shidduch, you can get a translation later, but a match, they make sure the couple doesn't have these genes, because otherwise there's a very reasonable chance they're going to have an affected baby. Tay-Sachs is a terrible condition. Usually results in a fatal death at around 2 or 3 years old.
And attached to that question, is nuchal translucency measurement the test to use for Tay-Sachs?
No. Nuchal translucency is a test for genetic problems, particularly trisomy 21, Down syndrome.
Okay. What are the chances of getting pregnant after a pregnancy in the fallopian tube and removing one ovary?
Removing one ovary, non-issue. Studies show very clearly that a woman's fertility after removal of an ovary is the same as a woman with two ovaries. Women who have a pregnancy in the fallopian tube are at risk for subsequent pregnancies in their fallopian tube. Overall, the risk in the population of a fallopian tube pregnancy is 1%, 1 in 100. In women who've had a fallopian tube pregnancy, their subsequent risk is 15%. If they have 2 fallopian tube pregnancies, it goes to 30 or 40%. The reproductive performance of women with fallopian tube pregnancies is bad, and many of them will end up in vitro.
Okay, and if someone has already had breast cancer, do they still need the HPV testing?
Two separate issues. Breast cancer is a disease of the breast related maybe to hormones, related to who knows what. HPV testing is for diseases of the cervix. That's the neck of the womb, down there. HPV virus, good question, has nothing to do with breast cancer. HPV virus has a lot to do with cervix cancer, vaginal cancer, vulvar cancer, as an audience member, head and neck or throat cancer. I'll let you explain to them how you get that virus in your throat. I'm too young. And anal cancer. So HPV virus is responsible for at least globally 1.5 million cancers worldwide. And that's why people are very gung-ho about the HPV vaccine that you hear so much about. Gardasil or the new one, Cervarix. It's not about just preventing cancer, which is rare. It's about preventing all of the precancerous abnormalities that fill up our clinics, colposcopy clinic, where we check out women with abnormal pap tests. So even though there's only few cases of cancer, there are hundreds of thousands of cases of women with abnormal paps. And trust me, if you're a woman with an abnormal pap, it's a big deal to have an abnormal pap. When you get that phone call, you don't sleep for a few months.
Why have many of our OBGYN doctors given up on women over 70 years old and are telling us to have our GPs do internal as well as breast exams? Our GPs are not in agreement. So what do we do?
So this is more of a local Montreal and Quebec problem than a medical problem. We live in a province where they scared away the family doctors. There are not enough family doctors. Conservative estimates are that the province is short 800 to 1,000 family physicians who should each be looking after 2,000 to 3,000 patients. In the rest of Canada, your family doctor, which you all have, checks your boobs and does a pap test. You don't go see a specialist for a pap test. Quebec is a distortion of normality. So there are no family doctors. Many doctors have rachmanis, that's compassion, and say, listen, you don't have a doctor, I'll do your pap test and touch your boobs. I'm busy operating and looking after pregnancies. I don't have time to touch your 72-year-old boobs and tell you your vagina's warm and you're healthy. Go away. So we say, line up, wait for 3 hours so I can put my fingers in your vagina and say, yes, you have a vagina. Now, have a nice day. Because it is arguable that sticking a finger in your vagina is going to save your health or save your life. And I'll say it again, guys, hear what I'm saying. In the absence of a symptom. If you're feeling grand, then me telling you your vagina is there probably hasn't done you much good. You may feel good to have seen me. I'm very charming and say, wow, that was great. I had a coffee at Second Cup. I got to see Ziegler. I feel great. But I'm not doing a great service to your health. So I say, stay home. Don't bother me. I'm not doing it. You don't have to come and see me. Sit and wait for 3 hours while I go do a delivery and really make a difference in somebody's life. If you want to come, I've learned now, after 15 years, 5 years ago I said angrily, don't come. Now I say, I can't be mean. You want to come, come. Sit in the waiting room, come. But you don't need to come. All major organizations that study the benefits of a preventative health exam say, you should do a mammogram from time to time when you're 50. You should have somebody in an Armani suit stick a colonoscope up your butt, because they all are better dressed than I am, once every 5 years. You should check your cholesterol once in a while. But having a pap test after 70 is a useless waste of your time, my time, and the government's health dollar. So I'm trying to explain to you, these are not arbitrary decisions. So that's why here we say you don't need to come and see me. If you want to come, come. My colleagues, they may throw you out. They may say, I really don't have time to see you. I don't want to see you.
Okay.
Was that does that make, you understand why? You should be, and we all should be, discussing it with the hypocrites who are in our government, who are busy themselves going to private clinics and not allowing other innovative ways to deliver health care to come. That's who the anger should be directed to, not the doctor. And I say that without equivocation.
Tell us how you really feel.
That's how I feel. They should pay GPs better. It's not even about specialists. Family doctors need to be paid better, treated better, not treated punitively, and they'd stay here and work. But nobody in their right mind will be a professional who's gone through 12 years of school, will be dictated to by some bureaucrat who just got elected and on the next election is going to be selling cars in Chicoutimi or who knows what, telling him where to work. It's garbage.
And now you know why, when this video is online, some of these pieces might be bleeped out, and you understand why.
Don't bleep it out.
Okay. I'm aware of several ladies that breastfed and did become pregnant and had children. So what's the percentage of this happening?
So great question. Breastfeeding is not reliable birth control, right? But it's remarkably good birth control. In the developing world and in places that are sort of low budget, low tech, women know very well, and we know very well, based on data, good scientific data. Women who breastfeed religiously, that means breastfeeding on demand. That means walking around with the kid and breastfeeding at the Cavendish Mall, not having the nanny give the bottle 6 times and breastfeeding at bed. Breastfeeding on demand without a menstrual period, because if you breastfeed religiously, the hormones in your body turn off your menstrual cycle. Women can reliably use that as birth control for a year or two. However, if once you start to supplement, once the kid has a McNugget or two, and once you stop breastfeeding all that often, you can't count on it, and women do get pregnant.
I'm having trouble reading some of these because in the 4th week they feel that their doctor's already some of these.
scribbling.
So I'll interpret, but it seems that the question is, what are some of the indicators that would tell you and the mom that that there may be a need to abort a pregnancy?
Okay, that's that's really based. That's where I got into the ultrasound part. So I told you I didn't want to give ultrasound a bad rap, right? In ultrasound, once or twice a day, technician will put a probe on a mummy's tummy, and we're going to find a baby with some sort of really horrible abnormality, monstrous abnormality, missing a brain, heart that won't work. We're really, for a woman to have carried this to 9 months and have a surprise in a delivery room is terrible. So we do find some very serious abnormalities where it's very clear these abnormalities are incompatible with life. Now, some patients will say, thank you for the advice. I will let God make the decision, nature take its course. And one day the woman shows up for exam, there's no heartbeat, we induce her labor, and she has not had to make that cosmic existential decision to terminate the pregnancy. So that's the one extreme, where we find by ultrasound an abnormality that you would look at and say, oh my God, what's that? Then we have those little abnormalities where it's a little shadow, and the little shadow could represent a little abnormality of the kidney, which the baby might need an antibiotic for, or a little tube in the kidney, or it might mean total kidney failure and we don't know. Or it might mean this is part of a bigger genetic problem. So this is where we get on the Make Work project, where we tell the woman, we're not sure, you have to do more ultrasounds. You should probably do an amnio too to get some amniotic fluid and check out the baby. And there the woman can end up with some very difficult decisions. Sometimes these decisions result in her taking a decision to terminate a baby that probably would have lived quite well. An example, we find sometimes a baby with an extra Y chromosome. That's called a super male, XYY. Super male is normally a man who grows up to be sort of a little bit taller, physically quite strong. Some of these guys have violent behavior and end up in jail, but otherwise would look like a pretty normal kid. Well, some women will say, I'm going to terminate that baby. I don't want to have a baby like that. So when a woman generally makes a decision to terminate pregnancy, it's based on good ultrasound findings that show it's a very bad abnormality, and certainly it's probably preferable to her terminating the pregnancy at 4 months than to carry it to term, because some of these pregnancies actually may produce obstetrical conditions in the mother that put her life at risk. She may end up with blood pressure or seizures, and it's better that she had her pregnancy terminated.
Does an unprotected male automatically transmit HPV if he's a carrier to the female? And what are the chances of cancer?
Right. So here's a great question. Women, unfortunately, disproportionately bear the effects of getting this virus, right? We know men and women have it equally. So why is it women that we're doing Pap tests? Why do women get cancer of the cervix? The answer is God's unfair when it comes to that. Men don't get penis cancer. It's an extremely rare condition that's seen very rarely in men, generally from 1 or 2 parts of the world. But despite the fact that men probably equally carry the virus and transmit it to women, it's women who unfortunately end up with the serious medical conditions related to it. In terms of advising patients what to do, we know that 85% of us get the virus and that we get it from sex. The only way to have it is not to have sex. It is completely unrealistic. Tell a couple, well, she has HPV, you guys better stop having sex. So we have really no advice. We say, try to be responsible, try not to have multiple partners, but really once a woman is seen in colposcopy, my advice, please get on with your life as normal. You can't retreat to a monastery now. You already have the virus. We'll follow you and you should be okay. The good news is that even in women who test positive for the virus, invariably the virus clears on its own in 90% of women. So very few women develop cancer because most healthy women with a good immune system will clear this virus at some point. So you may have an abnormal Pap test, you may be seen by us and treated, but life goes on for most people.
So if the fold in the neck doesn't show Down syndrome, blood tests don't show abnormalities, would a woman who is 35 years old be ill-advised to do amniocentesis even if she's a nervous Nelly?
So that's a great question. Let's say a woman did the test I showed you, that Down syndrome test, the ultrasound and a blood test, and her results come back, let's give you a number, 1 in 800. Okay? First, I'm going to give you an easy one. Let's say it comes back 1 in 20,000. So most patients say 1 in 20,000, great. But we live in a society, I told you, of obsessive compulsives. So it'll come back 1 in 800, and let's say it's a 28-year-old whose risk really should be 1 in 1,000. So she looks at the results and says, 1 in 800, my risk should be 1 in 1,000. Why is it higher? Well, it's a little bit higher than your risk, but it's still pretty low. Some of those women may decide, it's not enough for me. I got to put in the needle. I got to know for sure. Well, that's a tough decision the woman has to make because she may end up doing an amnio and losing a baby that was normal in the first place. The different scenario is she's over 35. She does that first test and it comes back showing her risk is 1 in 50. So that's a real serious risk. All of us would say, listen, your testing shows you're at high risk, go do the amnio. And most of those women will still have a normal kid, but they should do an amnio.
Okay, and where is this done safely in Montreal? How much does it cost? And did you just mention the false positives?
So false positive rate is about 1 to 3% with that nuchal translucency. Test is offered at many clinics, OVO, Procrea, CDL. Certain doctors do it in their office, and they're all, normally those who offer the test are good at it. Amnio is offered at all hospitals. Our group here at the Jewish is superb. Our group of our prenatal diagnosis, ultrasound doctors and technicians are excellent, probably second to none.
Can uterine fibroids cause internal bleeding leading to death?
No. 1 in a million, extremely rare. Fibroids cause vaginal bleeding, resulting in heavy menstrual periods, and that can cause a lot of blood loss, but not internal bleeding in your body. You know, there is probably 1 or 2 reported cases of a woman bleeding internally from a fibroid. This would be exceptional. I see hundreds of women a year from fibroids. It's not a common issue.
Okay. Some women continue having hot flashes and night sweats long into old age. Yeah. With hormone replacement not being recommended after a given age, say 70, are there any other remedies?
So I feel sorry for those women. There is a hardcore group of women out there, I'm going to say 15 or 20%, if you look at the literature, that's what it seems to suggest, who will continue to have miserable hot flashes forever. One thing is for sure, if you're on hormone replacement therapy and you go off it at any age, if you take a woman off it who's 75, she'll have hot flashes. Once your body is used to that stuff, it reacts. But there are a core group of women who do badly with hot flashes. I didn't discuss menopause at all tonight. To summarize in a sentence our contemporary thinking of menopause, which is, unfortunately, that's the most distorted information that women get because it seems the information changes all the time. Hormone replacement therapy continues to be highly recommended to women with symptoms who are young. So if you are just going through menopause, i.e. early 50s, and you're having a miserable quality of life because you're having hot flashes and you're not sleeping, we still recommend hormone replacement therapy for a duration of about 5 years or less because it's been shown to be safe and not increase the risk of breast cancer with short duration. We do not recommend hormone replacement therapy to prevent medical conditions in older women. So 10 years ago, the message you got from us was, you're 65, go on hormones. You're going to have a lower chance of having a heart attack or stroke. We know not to recommend it to women that age for prevention of health risks. We treat it to treat symptoms in young women, and it should be strongly advised to women who are feeling crappy at that age. I don't think women 70 plus should be on hormones, no.
Is it nuchal or nuco?
Nuchal, N-U-C-H-A-L.
Nuchal.
Referring to the neck.
With the nuchal translucency tests, are there ethnic, racial, or otherwise normal variant measures? In other words, could some extreme measurements be considered otherwise normal?
Absolutely. There are norms. Blacks and Orientals have a different range of what's considered normal than white people, than Caucasians. Yes, it's a great question. Who asked that question?
Maybe one of your students.
I don't know. That's a fabulous...
Please discuss abstinence from a medical, scientific perspective. Why does there seem to be such a strong bias against it?
Sure. So, abstinence. First of all, to my knowledge, there are no... It's okay, it doesn't bother me. There are no known health risks associated with abstinence, despite what many men will say. I'm going to go insane if I don't have sex. I'm going to have a buildup of sperm. Though the literature on prostate cancer... See, I'm talking about penises, and look what happened to this. Literature on prostate cancer shows that men who ejaculate more often have a lower risk of prostate cancer. It rids the body of those toxins. So, For a woman, periodic abstinence, I think, is probably not a bad thing. You know, in our religion, a woman officially is not supposed to have sexual relations during her period and a few days after. I believe there's a certain medical genius to that. Studies do show that women who have sex during their period are at a much higher risk for pelvic inflammatory disease and other bad things. So it may not be great for your health to have sex during your menses. So in fact, there may be a certain benefit to the woman from having periodic abstinence. I don't see a problem with it. In the context of today's world, I think with healthy, safe alternatives to abstinence, it may produce a better dynamic in the couple's sexual life than abstinence. But I don't think there's a medical problem with it.
You'll help me read this one because I can't. Have you ever delivered a baby with?
Is that omphalocele? It looks like omphalocele. So omphalocele is a genetic abnormality where part of the baby's guts are actually outside of the baby's abdomen in a little bubble. I didn't show you all the gross pictures tonight. Trust me, you would have gone home with bad dreams. So omphalocele is a condition that we do deliver here. Omphalocele can be associated with other genetic abnormalities. It makes for a tricky birth because if that bag, it's the baby's bag, it's a bag of intestinal organs, are ruptured during birth, it can be a problem. Most common recommendation these days, it's again controversial to do a cesarean section or not, but it's a pretty rare condition. Pretty rare condition. What could cause that? We don't know. Nobody knows what causes that.
Okay. The IVF video gives a new meaning to go suck an egg. There's a little comment.
So we call those guys egg suckers.
And seriously, if IVF and ICSI are all messing with Mother Nature, which I think were your words, in your own words, isn't the pill, injections, and other similar intervention also tampering with a woman's natural cycle?
Yes, they all do, but we have to look at the risks and benefits of everything. I don't think anybody could argue IVF, as artificial as it is, as expensive as it is, as much as it's an emotional roller coaster for the women who do it, because it doesn't always work, as much as they have serious risks from, I told you, ovarian hyperstimulation, which can cause death. You know, they can end up dying from this. The good that it has done in allowing people who would have not otherwise been parents to be parents, I think is immeasurable. It's incalculable. So yes, you also take a risk having your gallbladder out by laparoscopy. You also take a risk in taking other medications. So let's not be totally nihilistic. It does good. With contraception, I believe that despite the small risks, benefits outweigh the risks. And that's at the end of the day how we all size up things for ourselves and for our patients. You want to do good. You want to do good more than bad.
Please comment on the advantages of vaginal birth and why women capable of the same would choose cesarean section instead.
Right, what's that called? Too posh to push, right? The idea that, right, in Brazil, too posh to push. In Brazil, the C-section rate in the land of bikinis, 75%. Guess what? Even in China, there's cesarean section rate close to 50% because there they have one kid, they want it perfect. I believe, philosophically, that a woman has a right to say, you know what? I don't want my bottom banged up. I don't want to end up incontinent of urine and feces. I don't want to end up with a gaping vagina. I don't want to end up with pain. I'm going to have one kid. I'm a busy career lady. Schedule me a cesarean. I've worked for years to have this kid by IVF. I want a little C-section. Truth is, I can tell her with C-section, I'm going to guarantee you a perfect kid, and I will. Evidence is clear. Babies born by planned cesarean section do better than babies born by unanticipated vaginal birth. There's no question. So if you want to have one kid healthy, and that's your crack at it, have it. I'm telling you, doctors are hypocrites. Many of them get up on stage and say, we should have more vaginal births. When you ask the doctor, how'd you have your baby? Well, I had a planned cesarean. I was 41 when I had the kid. So there's some hypocrisy there too. Having said that, the best thing for a woman to do is get pregnant when she's young and have a vaginal birth. Of course, that's the best thing. But in some cases, it may make more sense for a woman to have a planned cesarean than to go through what's going to be a difficult birth. My job as an obstetrician is to also give my input. I don't tell women you should have planned births. However, once in a while, I'll see a woman who's 5'1", 270 pounds. I know that if she has a cesarean section after labor, it's a nightmare for everybody. And I will get a second opinion from a colleague to say, you know what? You are going to be a horrible labor to look after. We know that doing cesarean sections after long, difficult labor is associated with many more complications in terms of bleeding, infection, and horrible surgery. We'll say you should have a planned cesarean. This is going to go nowhere. Have a C-section. So we use our judgment generally to do what's best. It's clear that patients and doctors all have their own individual tolerance for risk and will advise patients differently.
Please comment on the HPV vaccine, on its effectiveness, delivery, who would be a candidate, and risks.
Okay. HPV vaccine. You guys getting nauseous? I've been talking a lot. Janet Schinder wants to leave at 9, and I'm relieving her.
You got 4 minutes.
4 minutes. So once again, full disclosure, I have done talks on behalf of these pharmaceutical companies for this vaccine because it's an area I know something about. I'm going to tell you my first reaction to the vaccines when they came out. And it was about 10 years ago. Vaccines have been available and studied for close to a decade. 10 years ago, I said, we need a vaccine for this. Like there are 400 women that die a year. What do we need a vaccine? So I don't know if it's a bit of perspective with time, with the fact that I do a lot of this colposcopy, where we see women with abnormal pap tests. Here's what I feel about the vaccine. Let's talk first of all, the vaccine, it's a needle, it's given in the arm to prevent young girls, not women your age. We want to prevent young girls from getting this virus before they become sexually active. That's why the government pays for it in girls in grade 4 and grade 7. Our national government put $100 million into this vaccine because they were convinced that it was the right thing to do. They were convinced because the data, the scientific evidence on this vaccine is clear. It is safe. It can't cause cancer. It can't cause death. It has been given now in millions of doses across the world. It doesn't cause cancer. It doesn't cause death. It doesn't cause infertility. It's a safe vaccine. It will prevent young virginal girls who don't have the virus in their body with an efficacy of 99.8% from ever getting this virus or getting precancer. So the scientific evidence is clear. If you give it to a girl before the onset of sexual activity, she ain't going to get the virus, she ain't going to get precancer, she ain't going to get an abnormal pap test. Even if you give it to a woman who's already been sexually active in her early 20s, it will reduce her risk of getting an abnormal pap test or a precancerous lesion by about 70%. So that's still a benefit. It's not 99% because she may have had one of the viruses. Even in women up to the age of 45, there is a benefit. It's not as good as it is in young girls. So do I believe young girls should get the vaccine? Absolutely. There is no other vaccine that's been shown to be as effective. It's not going to give the girls cancer. It will not give them the message to go start having sex at 13. I don't believe it gives that message, and I believe that it should be available. Our government will pick up the tab for young girls. It is women in the age group of about 15 to 25 and maybe older, because in today's world, women are getting divorced and getting new partners and may be re-exposed to some of these viruses in their 30s and 40s. So it's a safe vaccine. It does much more good than harm. In an ideal world where we could give it for free, we'd give it for free, but we don't.
Okay, last 3 questions, last 3 minutes.
Sure.
Gynecologists don't need to be awake all night, and yet none of them want to serve women over 65. Why is that?
I think I explained that part before. We try our best.
Oh, okay.
Was that serve or service? I'm not sure what the question was. You make me a little nervous.
Can a 50-year-old woman...
I generally don't service women over 65, though. If the price is right, I could imagine. Better than what Medicare is going to give me, but anyway.
Okay, I'm going to let you read this one while I get the next one ready.
Can a 50-year-old woman with uterine fibroids not undergo any procedure and just manage the bleeding with medication until she reaches the menopause, until they shrink? I have given that advice hundreds of occasions, of course. Just having a fibroid doesn't mean you need to have it removed. If the bleeding is a problem, we have alternatives to surgery. First of all, doing nothing is perfectly acceptable, provided you've been examined and had pap test and a biopsy and we're sure the bleeding is just related to a fibroid. So, of course, you can do nothing at all. But if you're bothered by this, if you're bleeding heavily, requiring blood transfusions, or it's really just cramping your otherwise happy life, we have injections to stop your periods. We have procedures that are non-surgical to shrink your fibroid. So, absolutely, yes, there are alternatives. It is completely acceptable to do nothing. Sure.
And the final $64,000 question is, do you take new patients?
So here's a final story. I'm going to tell you, this is a true story. I work here at the Jewish General Hospital for years. I have. About 5 years ago, I started to get burned out. I said, I'm seeing too many patients. I need to be protected. I can't see 60, 70 people a day. I'm tired. So I went to work in a pseudo-private clinic, which is not a private clinic. I love to work there. It's a day a week where things are a little bit different. I'm not mentioning names. And then, you know, it turned out I was there a day a week, started becoming 2 days a week because there was a big demand there. And this is the truth. We, because we're a great place to work, have recruited a lot of new doctors at this place, and we moved to a new place in Pavilion H. It's wonderful. We all work together as a team. We work very well as a team of OBGYNs at this place. We have, over the past 10 years, put away ego, and we really cover labor and delivery as a team. We work as a team, and we like each other. So the truth is, we have to share the playground there. I can't be a hog. I can't be there every day a week. So I said to myself, you know what? The private thing, it's nice, but I don't want to be there more than a day a week for a variety of reasons. It's 1 day a week. It's a change. I said, they're opening up a new CLSC a block from my house. Why don't I go work there? Maybe I'll go there a day a week. So I made some inquiries, and I'm looking into it, and it all sounds great until yesterday. And I'm candid with you. You see that I say it as it is. I said to myself, I'm willing to go to the CLSC, and I will not be a snob. I won't say you have to come with a referral. I'd be willing to see any woman who lives in the neighborhood, or who's my patient, who needs a checkup. It's a nice place, close to my house. They can arrange things for me. Then I found out yesterday, after talking to a lot of people at the Régie, and I know you don't care, okay? I know it's not an issue for you, but I'm just explaining how things work here, why you can't find a doctor. The government will pay me half of what it pays me here to see a patient there. Now, it doesn't make sense to me, right? I'm working here in a public place, right? I'm not telling you how much. I'm not going to give you a number. But I said, why? So I spoke to a couple of people, and they said, well, we don't have an answer. That's just the way it is. So I'm thinking to myself, I'd like to do a good deed, but I'm not a missionary. I'm not Albert Schweitzer. I don't want to work for nothing. I'd be really embarrassed to tell you what the number is. I won't. So now I got to find out, does this make sense for me? I'm not going to go kill myself there for nothing. So I'm sure that I'll work out some way to accommodate patients. I'm happy to look after people, but I want to leave you with one thought. The trained specialists that are here at the hospital are not the group of people who should be providing primary care. I said it before, your government has to make it more palatable for family doctors to work here, for new recruits. Also, to make nurse practitioners, as they are in Ontario and the rest of the states, be available to do a lot of the screening stuff. Nurses are caring, intelligent people. Many of them now are highly trained with master's degrees. Many of them are chomping at the bit to expand their range of activities. And a lot of things that doctors are wasting their time doing, ticking this, ticking that, should be done by a qualified nurse practitioner working in a team with a doctor. That will be the solution, and many of us are looking forward to working together. The way I work with Dr. Hagshi, the way other doctors work in teams, it has to be the day of the doctor as the lone ranger are disappearing. So hard to find a doctor for that reason. Anyway, that's
very much. Thank you, Dr. Ziegler, for a real folksy presentation. Greatly appreciated. We want to thank you all. You are officially graduated as Moctors now. You've got your diplomas there and your gifts. Please hand in the feedback forms, very important. And just so you know, Mrs. Klein is fine. She was anxious, I think, to get home and have the cake, and she's gone home early, but she is absolutely fine. Thank you all once again, and check online for the online version, and we will see you again next year.
So I have to tell my wife, I have 4